Infectious Disease Prevention in School Children by Rebecca Rust, RN, Nursing 470, McKendree University. My topic of interest is infectious disease prevention in school children. For example, upper respiratory infections, the common cold, croup, which is secondary to a cold, ear infections, also secondary to a cold, influenza, gastrointestinal illnesses, such as norovirus, and conjunctivitis, or better known as pink eye. The target population is school children. Because while all people are prone to illness, no matter what age, the population most susceptible to illness is children. And in elementary schools where the setting is crowded, items are shared, and there is a greater lack of self-care skills, microorganisms are readily transmitted either by inanimate vectors or contaminated hands. Research has shown, and as reported by the United States Department of Health and Human Services, that acute respiratory infections, including pneumonia and influenza, are the 8th leading cause of death in the United States. During the 2009 H1N1 influenza A pandemic, it was estimated that between the months of April 2009 and March 2010, 1,270 of the 12,270 deaths reported were children under the age of 18. That's approximately 10% of the total deaths for that time period. Approximately 75% of all school absences are attributed to illness, which has been shown to lead to a negative educational and economic outcome. In the fall of 2009, the state of Michigan suffered a pandemic of the H1N1 influenza A, which led to a reported 567 school closures, mostly related to high absenteeism rates. Approximately 188,000 school children and teachers were affected, and in one day alone, 82 schools were closed. In 2008, the state of Kentucky also experienced a seasonal influenza outbreak, and 2 of their school districts shut down because of it. The impact of absenteeism. Hands are a mode of transmission of infectious disease among school-age children. Therefore, hand hygiene is necessary in the reduction of illness-related absences, which is a major problem among school-age children. The potential for teacher absences due to exposure, loss of school funding, as well as the possibility for students to be the source of community outbreaks by having carried the infectious agent from home to school is a serious concern. Unplanned teacher absenteeism increases school administrative costs with the need for student tracking and the hiring of substitute teachers, while students' learning is disrupted by the uncoordinated delivery of the curriculum. To your right, you can see a clip art that I found. Absences add up, #SchoolEveryday. Missing just 2 days a month means a child misses 10% of the school year. You can go to attendanceworks.org for more information about absenteeism and its effects on students. From an economic standpoint, public school funding formulas are based on attendance numbers. Therefore, increased absenteeism means there is a decrease of federal and state monetary contribution to school programs. Additionally, the burden of costs incurred upon a parent caring for an ill child at home could include costs from physician visits, medications, hospitalizations, and the loss of work productivity. All negatively affect the economy. Ingrid Koo a PhD and infectious disease expert, recommends hand washing as a prevention method for the more common infections seen in children. The World Health Organization and the CDC also cite that hand hygiene is a cost-effective and important hygiene measure in the prevention of the spread of infectious diseases. Hand hygiene is also a key intervention for reducing transmission of acute respiratory infections and other infections in the community, such as diarrhea, and it has also been specifically recommended for prevention of diseases with pandemic potential, such as influenza. In 2010, Lee and Grieg conducted a study to review the documentation of outbreaks of gastrointestinal illnesses in schools over the last 10 years, specifically the years 1998 to 2008. Of the 121 outbreaks reviewed, 51% were bacterial and 40% were viral. And of those, nearly 4 times as many children became ill via bacterial contamination than by viral contamination. And again, as reported in this study, norovirus was the leading cause of outbreaks, with E. coli following closely as a second problem. The main causes of transmission were recorded as foodborne, 45%, and person-to-person at 16%. And whether poor food handling was to blame or person-to-person contact, the number one suggestion for reducing future outbreak was enhanced hand washing. Additional support for the importance of hand hygiene to prevent the spread of norovirus comes from the Center for Disease Control's release of an updated report in 2011 on norovirus outbreak management. In the report, hand hygiene is listed, and I quote, as the single most important method to prevent norovirus infection and control transmission. This clip art to your right was obtained from the CDC's website, and it just tells you how contagious norovirus is. Just a small amount, as few as 18 viral particles of norovirus on your food or hands can make you sick. That means the amount of virus particles that fit on the head of a pin would be enough to infect more than 1,000 people. You can get more information about norovirus or just about any kind of disease on the CDC's website. So Lee and Grieg also pointed to a successful controlled study in Illinois where increased hand washing was shown to be effective to reduce absenteeism rates in second graders after discussions and hand washing demonstrations were conducted. And in another study in Utah, improvements in hand washing were noted where a guest educator taught about hand washing and germs, and where visual clue, teacher hand washing, and verbal clue were given. Teachers make a difference by taking time to discuss the transmission of diseases during their daily teaching, by leading by example, and encouraging hand washing before lunch. These are all ways to teach students how to prevent the spread of communicable diseases. Effective, supervised, and early teaching of hand hygiene is necessary in preventing illnesses among students and the community, and teachers in schools play a vital role in instilling these good habits in their students. So the community group that I chose was the Morgan Elementary School in Paducah, Kentucky, which is a pre-K through 5th grade elementary school. According to the most recent demographics from 2014 and is listed by schooldigger.com, Morgan Elementary consists of a student body of 371 students. Of those students, 45.3% are white, 30.9% are black, 12.6% are mixed race, 10.2% are Hispanic, and the remaining are other ethnicities. The male to female ratio is 55 male to 44% female. The student body relies heavily on free or reduced lunch, with 84% of the student population enrolled in this program. This means that a family of 4 must earn no more than $44,863 a year to qualify for that program. The specific target group during the presentation was Morgan Elementary students from the second and third grade classes, with a count of approximately 45 students total over 2 days. The demographics of those two classes consisted of mainly white and black students with a few Hispanic students, and there were no learning barriers present. The community health project that I presented included several websites, information from several websites that were recommended by the CDC, including itsasnap.org, kidshealth.org, glowgerm.com for demonstration materials, and also information from the cdc.gov. All of these websites included information that was age specific, so that made it really easy to get an idea of how to present to the students. The Community Health Project included a PowerPoint presentation that included 12 slides aimed at the second and third grade levels. The material was presented in a way that was fun and transitioned in an animated way so as to keep the attention of the students. I used familiar cartoon clip art and engaged the students with questions that they were able to answer. And they were instructed and then joined in on the 6 hand washing steps. YouTube address is on this slide. If anybody wants to check out the PowerPoint presentation that I did, you're more than welcome to check it out. I didn't do a voiceover. This was presented on a large white wall, and I just kind of went through my presentation and clicked through each of those slides. The kids really enjoyed it. After the PowerPoint presentation, I did the glow germ demonstration, and I randomly chose 3 students. Basically, we just took the glow germ gel and put it on their hands, had them really get it good and dry on their hands. We looked at their hands under the black light, which simulated the germs on their hands, and then we all went through the steps, the hand washing steps. After the hand washing steps, we took another look under the black light to see how well they had washed their hands, and they actually did pretty good, and I think this was probably their favorite part of the whole presentation. Lastly, I did handouts. As you can see on this slide, the handouts included a word search and unscramble the words, and then a mix and match handout, and then the connect the dots and which are both coloring pages, and then a wash your hands coloring page as well that shows them all the steps of how to wash their hands. The behavioral objectives of the community project was to engage the students in a way that would induce full classroom participation and interest in the presented materials, and also just to see what the students already knew about germs and hand hygiene. This included how to wash their hands, when to wash their hands, how long, and why. The project was put together with the intent to either reteach the students hand washing techniques or just to reinforce their knowledge of what they already know about this material. Of course, the short-term goal of the project is the prevention or the decrease in the spread of germs, which hopefully leads to a decrease in the number of second and third grade students that visit the school nurse's office with cold or influenza symptoms throughout the cold and influenza season. The long-term goal of my community presentation was to hopefully encourage a hand washing initiative after the presentation was given, with an overall goal of simply promoting a healthy habit. The purpose of choosing hand hygiene as the community presentation, and specifically to a younger demographic, was to reinforce, reteach, or to teach a behavior that is easy to learn, not time-consuming, promotes healthy habits, and has been proven time and again to be an effective measure against spreadable disease. The process takes less than 5 minutes, but the benefits could mean the difference between an illness-free cold and flu season or a pandemic outbreak. That's all I've got. Thank you for listening.